cars, and it's often forgotten that even in the very modern year of 2024, based on past projections, 1.3 million people have died worldwide from car accidents. In Italy, specifically in 2023, there were more than 3,000 deaths, and for each death, we statistically have 4 to 5 serious injuries. So that means there are about 12,000 serious injuries, a conservative estimate, yet no one particularly questions the use of cars or motorcycles. In other words, no one demonizes cars themselves, rather it's the way they are used. The advantages of cars, on the other hand, seem to be so undeniably high. That's 30,000 deaths and 120,000 serious injuries every 10 years. They are a relatively acceptable share. Let's remember these numbers and our emotional and pseudo-logical reactions when it happens. One death somehow associated with AI, or even when we criticize medications. So this is not about approaching the issue with millennial fears or seeing AI as an enemy. It's the way we see it that makes the difference, and that perspective depends on us. Because at least for now, ChatGPT or Claude or Gemini or Copilot, which is still GPT, don't jump out of the screen to force you to do things with them. It's us, just like when I talked about the kids who have AI do their homework for them, who negatively modulate our interaction. So, we've reached the point. What prospects do I see for applied psychology with patients with the advent of AI? I think it's pretty easy to imagine what could happen in terms of counseling. Psychological. So it's relatively quick to create a chatbot. Let's say an app through which we can chat, simply put, that acts as a virtual psychologist, absolutely well trained on a technical level, since they train it with many more texts than a flesh and blood psychologist could study. And they also train it on supportive motivational phrases and so on. They charge a monthly subscription fee, let's say about $15 a month, and the user can consult the psychologist 24 hours a day. So if he has a panic attack at 2 in the morning, if the patient has a panic attack at 2 in the morning, he couldn't call, for example, me, but they can absolutely chat with an AI psychologist who can assist them 24 hours a day, or at night. It can give them some tips, assess the situation, and keep the person company for 3 hours straight. Well, if I think about this, it will soon surpass simple psychological counseling or support. But here we come to the real added value of the psychologist, especially the psychotherapist.